is just joining, feel free to let us know in the comment section or in the chat section where you're tuning in from so that we can better gear our discussion towards your location. If you have any questions, put them in the chat, the comment, or the Q&A if you're joining us on Zoom, and we'll get started in just a minute. Looks like we have somebody on Facebook joining us from the hallowed halls of Mother Nature. I wish I were there myself this morning. But the Wi-Fi is very unreliable, so we didn't want to risk it. So welcome everybody. My name is Lindsay Morse. I'm the communications manager here at VIA. Before we get started into the conversation today, a little bit of a refresher on Zoom or Facebook Live and how you can connect with us today. So if you're on Zoom, you have both a chat option and a Q&A option. If you have a question, go ahead and put it directly into the Q&A option. If you don't see that and you see the chat instead, feel free to put it in the chat. We'll get to it either way. If you're joining us from Facebook Live, just leave a comment. We have somebody facilitating that and they'll let us know the question and we'll be able to answer all of those questions as well. Before we get into the Q&A section, we are going to do a little bit of an overview about what's been going on lately at VIA, our response to the COVID-19 pandemic, and a little bit about what we're looking forward to in the future. So today we have joining us 3 of our staff members. We have Frank Bruno, VIA CEO, Lisa Curtis, she is the Director of Development and Community Outreach, and Lisa Bitzer, who is our Director of Mobility Programs. I may have butchered one or more of those titles, and I apologize. So to kick things off, Lisa Curtis is gonna give us a little update on VIA, and then we'll hear from Frank and Lisa, and then we'll move into the Q&A portion of the event. Feel free to leave a question at any point, and we'll get to those in the order in which they come in. So Lisa, I'm gonna hand it over to you.
Thank you, Lindsay. I want to welcome everybody who's joining us today. I think everyone here and probably many of you wish that we could do this in person like we did last year. We did town halls around our service area and we loved doing it and I think people appreciated it. And I wish we could do that again and we will eventually, but in the meantime, things keep going. So we're still keeping to our town hall schedule. So I want to introduce Frank Bruno. He's our CEO. He has a tremendous amount of management experience, both in the private and public sectors. He was the city manager for the city of Boulder. He was a chancellor at CU Boulder. He was the CEO of Western Disposal. And we're really, I think, fortunate to have him. He is the coolest, steadiest hand at the helm that you would want to have, especially at a time like now, where we've really been challenged. He's led our team. I think we're very grateful to have him. And so here's Frank Bruno. Thank you.
Thank you, Lisa. Thank you, Lindsay. I agree that it is a lot of fun to do these in person. We had a great time last summer going around to the different communities, but right now that is more difficult than it ever has been, and it's just keeps striking me that the year began on a positive note in so many ways, and we slipped into February and all was going well. And, we knew about the pandemic at that point in time, but it didn't feel very local by any means. And even when it hit the US, you always have that sense that maybe this community will be, or this state will be spared, but not this kind of a pandemic, obviously. This has been obviously so global, we know that. And the impacts are not just on one economy, one sector, they're across the board everywhere. Everyone's impacted in one way or the other. And VIA is also impacted in a big way. Just a little background, we're a company that is about 40 years old in terms of our founding mission, Paratransit service. And we have currently about 320 employees, although at this present time, many of those are on furlough. And we're doing everything we can to help them during this time and to be able to bring them back as soon as we possibly can. That's our goal. We do have more of a a lot of entities say they're more of a family environment, but I think we really do all care about one another a great deal. So, our employees are our company, and, if we're not taking care of them, we're not taking care of the company. So at present, that's once the pandemic hit Colorado and it was clear that we were going to have the stay-at-home order enforced or in place, we began to shut down our different elements of service in cooperation with the entities we serve. So we have contracts with RTD for Access-a-Ride and FlexRide, and clearly those would begin to diminish. And our own signature founding paratransit service, people could no longer go to where they needed to go. And so that service has really declined dramatically. And as I say, we've furloughed now about 40% of our employees. We've already brought some back because of some new things that Lisa Bitzer will tell you about. But we're deeply impacted by this. I could tell you that in addition to the furloughs, as you can imagine, we've taken many different actions across the board in the organization with respect to expenses, and the senior staff and we've all voluntarily taken salary reductions to aid in the company being just a bit more sustainable during this time. And I think we're not the only entity to do that or to think about doing that, but we're all in it together, and that is just a reality. And as Lisa said, I do have some experience, obviously not with a global pandemic, none of us do, but we had H1N1 hit the region in 2009. I was a vice chancellor at the University of Colorado here in Boulder at the time, and we had the same degree of preparedness and concern that we have now, although there were no stay-at-home orders. And then similarly, when West Nile virus hit the region in 2004, we had to gear up because we didn't know how deadly that would be. So there's always challenges, whether they're floods or wildfires, and you really do have to take a steady approach and just look to tomorrow. And as we look to tomorrow, and I'll kind of end on that note, we're continuing to serve the region today and take people that have chemotherapy appointments or dialysis appointments. And Lisa will tell you a bit more about that and some of the other things we're doing. We're also delivering our contract services on the HOP, which is a fixed route municipal route here in Boulder. And we're starting to see Access-a-Ride and FlexRide come back a little bit. And I know everything will be very gradual. It won't be a straight line curve upward by any means. It'll be gradual. But as we look to the future, VIA is very much positioned to be a player in the regional transportation network. We're doing that now. We're growing, we're strong, and we're laying the groundwork for a company that will see the eventual transition to an all-electric fleet of buses, and they will be powered in hopefully in the shorter term by an all-solar and battery array here at the VIA home campus here in Boulder. And so that is our goal. We have a robust sustainability environmental goal, and we think that's how you set yourself apart as a company, is to deliver great service and to have a great organizational ethic. And I believe that VIA does. And I can tell you that as I think about my own values, after 40 years of being in business and government and higher education, I wouldn't want to be anywhere else. This is where I want to be. I want to help lead VIA and the community out of the pandemic and into that future that I just mentioned. But I'll turn it over to Lisa Bitzer, who will, well, perhaps Lindsay will moderate this, but we'll want to get to Lisa Bitzer and have her describe some of the other things that we're doing here.
Thanks so much, Frank. Yes, we'll turn it over to Lisa, and Lisa's going to give us a little bit of an update about what we've been doing differently lately. We've had some new opportunities arise as we're dealing with the pandemic. So Lisa, take it away.
We're doing things that are quite different compared to what we have done in the past. With this pandemic, we have had to think outside the box and be there for the community. Some of the things that we're doing is that we are doing grocery delivery. So if you need your groceries picked up, King Soopers, Safeway, from food shares, like the community food share in Louisville, from EPA, places like that, we can go ahead and we'd be more than happy to pick up the food for you and bring it to your home. We're picking up prescriptions and bringing and delivering them to people. So we are definitely thinking outside the box and making a difference and trying to meet the need when people call and what they need and how we can be of assistance. We're taking people to cancer treatment for their chemo and radiation, and we are also still serving the people that have to go to dialysis. We'll take you to the grocery store. So if you need us, just want to let you know we are open for business and we will help in any way possibly can.
Lisa, can you talk a little bit more about what the impact has been on our service before we got all of these new opportunities working with community partners? Tell us a little bit about how this impacted us initially and the steps we had to take.
Yeah, it impacted us. This pandemic has hit us pretty hard. We've got about 75% of our drivers, the VIA Paratransit drivers, that are on unemployment. And so we've had to take good measures to reduce the people in the call center, because of course not as many calls coming in. Many of us are working from home when we possibly can. Some of us come into the office from time to time. Some of us are here all the time. And we have taken measures on cleaning our vehicles, and drivers are wearing masks. They have hand sanitizers. They clean the vehicle before every boarding and after every boarding. And then at night, the vehicles are cleaned by our detailer in a big way to make sure that everything is disinfected. So there's been additional cost for VIA to be able to do all these things. And of course, to keep everybody safe. We also ask that if you're going to ride with our service, please wear a face covering. So it can be a mask, it can be a scarf, it can be whatever you can get that would cover your nose and your mouth. And so we've had a lot of impact. A lot of staff that's still is working hard. Drivers are doing a fabulous job, and we just want to make sure that we're here for our community.
Thanks so much, Lisa. Another point that the community may not see since they're not coming into the office, but we've also implemented temperature checks for everybody who is physically coming into the VIA facilities, and that we started about 2 weeks ago. And everybody has to sign in and get their temperature checked when they arrive and before they leave, so we can keep track of that. And if anybody is showing a fever, we immediately send them home and make sure that they're isolating before returning to work. And then in the office as well, we're also at a reduced capacity. Like Lisa said, a lot of folks who are working from home as much as possible. And we're implementing physical distancing in the office, and everybody in the office as well is required to wear some form of face covering. So we've taken a lot of measures to make sure that we're doing as best we can, and we're all just trying to work through it and figure out what works. Great, thanks so much, Lisa. So going to unspotlight you so we can see everybody again. And Lisa, you talked a little bit about how we're keeping the drivers safe, and we are requiring folks, is that correct, to wear face coverings if they're riding with us unless they have a condition or medical reason that they cannot?
That is correct. We want them to be safe. We want our drivers to be safe. And so since Boulder County and many other counties have put the restriction of wearing face masks or face coverings, we definitely require that for anyone that would board our vehicle, unless, like you said, they have a medical condition, severe asthma, something like that, that would prohibit them from doing so.
Right. It looks like we have a question that came through on Facebook that I would love to have you address. How would somebody go about scheduling a grocery delivery?
Oh, very easy. So the first thing they have to do is be a registered rider with VIA. So you can call 303-447-2848 and put in extension 1014, and that will put you through to someone that can get yourself registered, or if you want to register a loved one. It takes about 5 to 10 minutes over the phone, not long at all, just ask some questions. And then once that's done, we can start scheduling the trip. So what you would do is that you would contact, if you want a grocery store, you'd contact King Soopers, Safeway, or Walmart, put in your order, pay for it, and then you can call us after the fact and let us know what time and what day to pick that up. If you're going to use community food share in Louisville or EFA or the Boulder County Farmers Market for delivery, then you just go ahead, you place your order with them, and then give us a call and let us know a time and a place that will work, and we will go ahead and put that in. We'll go there, pick up the food, and we'll bring it to your house.
Awesome. Thanks so much, Lisa. And if anybody has any further questions on that, the best way to get answers is at that phone number that Lisa said, the 303-447-2848, extension 1014. I put that in the chat, and we'll make sure you have that on Facebook as well. And they'll be able to answer any questions you have about our services in general, not just grocery delivery. Great. Thanks so much, Lisa. So it looks like we have a few more questions, and I would love to talk a little bit about how this is going to impact us moving forward. We've talked about some changes we've already made, but what is the impact going to be as we move forward? I'm wondering, Frank or Lisa, do either of you want to take this one? Great, Frank, unmuted, and you're ready to go.
Thanks, Lindsay. I appreciate that. Yeah, I've actually been sitting here thinking quite a bit about it as Lisa was giving you that rundown, and I think we do have to be a bit sobered by the realities that during the pandemic period, businesses obviously are really quite scaled back, and for communities, sales tax has really declined dramatically. And here in the state of Colorado, most of our municipalities really function, their annual budgets are based on sales tax collections and projections for increases each and every year. And Boulder is very much like that, as is the rest of the region, Boulder, Longmont, Louisville, Lafayette, Superior, the region that we serve in here, all the way down to the Denver metropolitan area. All of these communities are seeing significant declines in sales tax revenue, which will also mean that state entities will see declines in sales tax revenue. And all of this, and I won't get too much into detail, but all of this means that there will be less funding available across the state, across the Front Range, for a variety of public sector types of needs and contracts that we have with entities like RTD, for example. But on the paratransit side, there is a fact of life that I think it bears mentioning, that paratransit in and of itself is a very expensive proposition. The door-through-door service that VIA provides as our signature is wonderful. It's really can be life-saving in so many ways, or life-changing at the very least. but it's a very expensive service. It's up in the $47 per trip range, and that's not per round trip, that's one way. And that across the nation is actually a pretty good number. We're not the highest, we're not the lowest, but we're in a very good sweet spot for the cost of the paratransit. So what you need to do, because obviously the participants can't pay that one-way fare by any stretch of the imagination. We get funds from governments and from the state to try to help that. But what we also do, and this is what is unique about VIA, is we use our earned income contracts that I talked about earlier to subsidize our paratransit program. And that is a bit unlike anyone else around the country. There's some similarities, but we do it a little differently still. And as all these revenues decline, and as people have a harder time, with purchasing, and these sales taxes decline, there's just going to be less money available. And as we start growing out of this or climbing out of this, VIA will have to, just by virtue of our own budget, have to live within our means and be able to provide the trips that we're able to fund and provide in a way that maintains the sustainability in the long run for VIA. And I don't like saying that, because when I say that, I know what that means. It means we can't provide as many rides as there is demand. And that is also a bit of a fact of life. So I think as we start to come out of the pandemic, I think it's time to really have a regional conversation about the cost of paratransit and the need for paratransit, and really looking at new ways to fund paratransit and new ways to at least acknowledge that if people need the service, we've got to figure out how to provide that service and how to be able to afford that service. So I think these are some of the challenges we have, but that's what we thrive on, and we're good at that. And I have, no doubt that we will use this moment. And I think that's the other important thing, is to use the moment that you have, this crisis, to try to change the way things are going. We see from even an air quality standpoint that doing this very type of meeting, and we're doing a lot of these meetings, as you can imagine, and everyone is, well, that's saving a lot of commuting miles, and it's really helping our air quality. As we come out of the pandemic, there's no reason why we can't continue to do more of this. That's not as much fun as being with everyone in person, but a lot of our meetings can be done this way, and it helps with cost, it helps with air quality, it helps with a lot. Same thing with how we fund our services. It's time to change it up, to change things for the better, and I know we can. It's just going to take some really serious thinking and serious conversation, and acknowledging reality, I think, is what we've got to all do.
Thanks so much, Frank. I definitely want to expand on that a little bit, but before we move forward with that, we have another question, this time from Debbie Knoll, who is a rider with VIA and also a board member. And she was saying that she is a little bit uncomfortable about drivers having to be so close when she is getting her wheelchair secured in place. Can we speak on that a little bit, about what measures we might be able to take to make sure folks are comfortable having to be in such close quarters inside the vehicle? Are we doing anything already? And do we have any thoughts for moving forward? Lisa B., would you like to talk about that a bit?
Sure.
You're unmuted.
Okay, thank you. Yes, we are taking precautions. We're doing all of our trips with buses. We're not using any of our MV1s or our Priuses, so we can practice social distancing on our buses. When loading someone that's in a wheelchair onto the vehicle, with wearing masks, and wear gloves, the customer is wearing a face covering, we can go ahead and keep them pretty safe, to get them on the vehicle, to wipe things down. They have Clorox wipes and things like that to keep things sanitized, nice and clean. And we're doing our very best to try to do one person at a time on our paratransit trips. the possibility you could be on with another person, but there is plenty of room in our buses for social distancing. And so you can put one person in through the front door going up the steps and getting onto a seat. And then you can also use the lift to put them towards the back of the vehicle so that that way people don't have to walk past each other or be worried about too close of contact. So I think we're doing everything that we possibly can to keep everyone as safe as we possibly can. And so far, it's been quite successful.
Thanks, Lisa. And I think another point for those who may be just joining us to remind everybody that if you are not personally feeling comfortable yet riding with VIA, there are some options that we have available for you so that you can get groceries and medication delivered if you're not comfortable yet leaving the house. And I will take this opportunity to remind everybody and welcome those who are just joining us to leave us a comment or a chat with any questions that you have that you'd like us to address. I think next we'll move into talking about some of our sustainability efforts that we have going on, what we're looking forward to in the future in terms of how we're going to grow and expand our renewable fleet. And I would love if Lisa Curtis could jump in and talk a little bit about this.
Thank you, Lindsay. Yeah, this is a really exciting part of my job is to talk about the future of VIA and where we're going and some of the innovations. I always think of VIA as, and the reason I joined VIA and work here is it's a values-driven organization or mission-driven, but our mission is grounded in values. And one of those values is, obviously, primarily, we were founded to provide transportation services for those with limited mobility. But we also value our life in the community as well, and our responsibility to ensure that we have a better environment, that we're invested in improving the environment. I think, as everyone knows, transportation and cars are one of the leading factors in producing greenhouse gas emissions, greenhouse gases. So I'm really excited about where VIA is going in terms of reducing the carbon footprint of our fleet. We're moving towards electric vehicles with a mind toward, with an awareness that, electric may not be the only solution in the future. There may, hydrogen fuel cell vehicles might become more practical in the future, but we're moving to reduce the footprint of the fleet. And that entails a lot of long-term planning because, if you're powering an electric fleet from the current electric grid, you're still contributing to some greenhouse gas emissions. So as Frank mentioned, in the shorter term, we are going to be capturing through solar panels on our site, solar energy that we will store in backup batteries to power the electric fleet that we're moving towards. We're going to be the first. We have some of our HOP buses that we use for the HOP bus route in Boulder. By the end of next year, we'll have about 5 electric public buses. But we're also going to be the first agency to have electric buses for our paratransit clients. So we've just gotten 2 grants that will let us do that. And that's going to be an experiment for the city. CDOT, the Colorado Department of Transportation, is looking to VIA to pilot the use of these new cutaway electric buses for our paratransit fleet. So that's really exciting. And, there's a lot of new technology coming that will help us be more efficient and continue to cut down costs. We're going to be doing eventually some on-demand transit, both for public and paratransit purposes. So that's what gets me excited and going in the morning.
Thanks so much, Lisa.
Sure.
So we had another question come in, more of a reminder for us. And for those who are just joining, I'll do a little bit of a repeat. We are making sure that our drivers, actually all via staff who is coming into the office, physically coming into the office, they have their temperature checked as soon as they arrive, and then also as they leave for the day. And we have a process in place if anybody is either sick or shows a fever, any signs of being sick, there's a process in place for staying home and making sure that those folks who have to stay home are compensated and still able to get the income that they need while they're self-isolating due to the virus, obviously. So let's move next into talking a little bit more about how our funding has been impacted. And Frank mentioned this earlier, and I would love for him to expand on this. But so Frank, I'll have you go first, and then Lisa can hop on later to talk a little bit more about what we've done currently to mitigate some of our funding issues. But if Frank, you could talk first about what's going on, how our funding is impacted now, and then what we're looking forward to in the future for new ways to fund paratransit since it's such an expensive service. You are unmuted and ready to go, Frank.
Thanks, Lindsay. Well, yeah, as Lindsay said, and as I mentioned earlier, there really have been serious impacts to funding across the board. And, as Lisa Bitzer had shared with you, 75% of our via paratransit drivers are on a furlough right now, which means it's part of the unemployment process. And just to let you know how we've done that a little bit uniquely, I think it's important to bear in mind why, again, as Lisa Curtis mentioned, our values, we decided that while people are on their furloughs and they can register with the unemployment department or register to receive unemployment benefits, we have chosen to pay for their medical health insurance premiums. And that is unusual. But again, I think it sets VIA apart and enables us to have a deeper relationship with those employees, not just the drivers, but with all of the employees that are on furlough. So that was the first thing that was really incredibly important to do, was to reduce the expenses to the point where we could at least try to lose as little money as possible, if not get it down to a break-even perspective. And that is very difficult at this point in time, but we are, for the month of April, we've actually gotten there. So that's a good sign, but we did that by making a lot of expense reductions like the furloughs. We had to reduce, our biggest cost is labor, so we had to reduce that right off the bat. And then I mentioned the salary reductions at the top. So those are the things we're doing in the very short run. But where is that impact coming from? Obviously, as I mentioned earlier, the sales tax receipts at local governments are really lagging and probably will continue to lag for the remainder of the year. I'm not an economist, but I think it doesn't take much to look at spending patterns and realize that there's been a significant hit on that. One of the things that I am grateful for is that there are, we all can look at this differently, the notion of internet taxation, that I think it's good that there is some degree of internet taxation now that comes back to the local communities, because the reality is when I buy something on Amazon, those vehicles are using our local roads to deliver that product to me. So back when I was city manager, I always thought there was a nexus that really would rationalize having some payment come back. And that helps a little bit as people had to move to more of the online purchase platform. But we've seen a decline in what cities can do. We've seen RTD, our Regional Transportation District in Denver, also they're a special district government and they're a taxing authority, and they too have seen dramatic reductions in their revenue package. And that then necessitated that they turn around and look at their contracts with VIA and with other providers like Access-a-Ride and FlexRide, and they reduced those dramatically as well. And when you think about Access-a-Ride, that's the other sibling service to our VIA Paratransit that is required by the Federal Americans with Disabilities Act legislation that requires a transit provider to provide an accessible transit. And VIA is one of 3 providers in the metro area providing that service, but that has been dramatically curtailed. And so that's another revenue stream for VIA that we saw dramatically decrease. So just in simplicity, or just to keep it very simple, think of all of our earned income contracts, maybe 4 or 5 segments of that. Think of them all reducing dramatically, and that's where we get our revenue to operate the organization, to cover our overhead, and to put about $10 per trip to subsidize paratransit. So without those earned income contracts, that's why we had to reduce the cost of our paratransit here, or reduce the volume of paratransit because we couldn't afford that cost. I think that's, Lindsay, is that kind of covering where you wanted to see me go with that?
It is, and we actually had a question come in from Facebook as you started discussing this. I believe you hit on all of the main points, but the question is, VIA Access-a-Ride was mentioned in the RTD board meeting on Tuesday night relative to our contract. What is the current status of that contract with RTD regarding Access-a-Ride?
Good. Okay. Two things that I would mention. As I mentioned, we're one of 3 providers in the metro area for Access-a-Ride, and I think one of 3 also for FlexRide in the metro area. But I think Paul Ballard, the interim CEO and general manager of RTD, mentioned this at the board meeting and talked about these contracts with VIA and the other providers. What he's talking about is, I believe RTD is using some of the CARES money they received. They've received about $230 million in CARES money, the legislation from the federal government, to address impacts of the pandemic on that organization and the regional transportation. And VIA is a part of that network. So they're using some of that money for us to bring back some of our drivers in both of those services. And they're coming back to provide really kind of what we do in VIA Paratransit, the one-off trip. So a client for Access-a-Ride could feel more comfortable taking an Access-a-Ride bus, knowing that maybe there are 1 or 2 people on the bus. And that is a different profile than the usual operation for Access-a-Ride, which could be up to 10 people on a bus. And so that's a contract expansion with RTD for us and for the other providers as well. We brought back several drivers and have put them through the retraining program as is required by RTD, so they can get back out on the road and do that. So those are very good things that we will bring in a little bit more revenue to the organization and provide a little bit more service to the clients and the public. There's one other element that is really important to keep in mind too, that annually VIA Mobility Services receives money from the Regional Transportation District, RTD, to provide paratransit in certain parts of our region. This comes from back in previous previous era, when VIA was providing service in what was previously a rural area and receiving what's known as Section 5311 fund. No one has to remember that. It's federal funding for rural service. And once the census tracts changed in the year 2000, though that service changed, and that area was pulled into the small urban district. Those are all designations by the federal government, and RTD took that service on, but they turned around and paid VIA for the service that we're continuing to provide in that area. So because of the difficulties they're seeing, we haven't received that money yet for fiscal year 2020, and it's about $780,000. And I know our sister entity in the Denver metro area, which is Seniors Resource Center, has a similar service and experience with RTD, and they have about $140,000 that has been delayed as well. So again, that further impacts our budget and would impact our ability once the stay at home and safer at home orders are really eased up a bit more and people feel a new level of confidence to get back out, start making external appointments for doctors that we can get them served once again. It's just going to require, again, a slower pullout if we don't receive that money. I think Paul Ballard may have mentioned that money on Tuesday night. We're trying to have discussions together. He's urged me to be creative in how we approach RTD and asking for that money, some ideas as to how they can provide some of that money to us to get that going, and we're going to do just that. But it's putting all these pieces together with Paratransit is really how it's done here and across the country. There's never one funding source. You can't rely annually on philanthropy or fundraising because what you receive this year may not be what you receive next year. And so it's very difficult to hire drivers and make commitments with clients unless you know what your funding base is going to be. So that's why there can be this concern for every dollar we receive and every dollar that we earn and how we can turn that into rides.
Thanks so much, Frank. That's a great segue into our next section. We'll have Lisa Curtis talk a little bit about what we've got going on to help us cover those gaps and some funding that we've received and some campaigns that we've put in place to be able to help cover the gap.
Thanks, Lindsay. Yeah, when the pandemic began, I was really concerned because right away it was obvious that it was both a financial crisis and that it could get bigger and bigger, and as well as a health crisis. And I think in that sense, everybody feels less secure about what's going on. And I thought that might have a really negative impact on our fundraising because of that financial insecurity. But I have been just so inspired by the people in our community who continue to give even through a difficult time and an uncertain time when the economy is really taking a big hit. It just reminds me again that this is, I think, is a community that has a lot of shared values, and that includes being concerned about our neighbors, taking care of people, ensuring that people who have mobility limitations aren't forgotten or left behind at this time, that their needs are still being met, that they're part of the community, that the community embraces them, as well as a commitment to environmental concerns. So while we're not getting we're not fundraising at quite the levels we have before, we are still fundraising in terms of the number of individuals who are involved in contributing to our mission of mobility for all. Not just mobility for a lifetime, but for the entire community, for affordable, equitable, and sustainable transportation options for everyone. And that includes people who are older adults, people who have some sort of disability, as well as people who have low incomes and for whom public transportation can be a barrier, the cost of it. So it makes me very hopeful to just to know how generous people are in our community. And we started at the beginning of the crisis, we started what we call our Help Our Neighbors Fund. And the fundraising for that has been fairly steady. We're about halfway to our goal. we had a generous matching gift of $10,000, and we easily met that $10,000, the current funding in the first few weeks. So I'm just heartened by the generosity out there. And I really love this community. Great people.
Thanks so much,
Thanks.
Lisa. So we got another question that I would love if Lisa Bitzer could address for us. Are we still using VIA's volunteer drivers? And if not, when are we planning on getting that program back up and running?
Love our volunteer drivers. They are absolutely fantastic, but unfortunately, due to social distancing, we are not using them at this time and really haven't been since the middle of March. My goal is to get them back as soon as possible. I stay in touch with them. I send out email blasts to them, just making sure they're all okay, which they are. They're home and they're doing what they need to keep themselves and their loved ones safe. But as soon as things lessen up a little bit and people can get out a little bit more, then we'll see about bringing them back and being able to perform rides. It just makes me a little uncomfortable at this time because we use Priuses and they're fairly small and for the trips, and it just makes me a little nervous that it's a little too close for comfort, having someone in the car and practicing that social distancing. So for now, it's on hold, but they will be back, and they are phenomenal. For those of you that might be tuned in right now that have been lucky enough to have a ride with them, they are just amazing people that care about their community and care about the people that we serve.
Thanks for that, Lisa. So with much of what's going on lately, we're sort of making it work as we go and learning as we go, as many are, and we are adjusting as we need to be able to accommodate new regulations, and we'll continue to do that. I think most of you probably know that our current Safer at Home is scheduled to end on the 25th, and we may be moving into the next phase of all of this. We'll have to see what our governor says this week to see what that's going to look like, and we'll learn it as you learn it. So for anybody who's just joining us, I know we have some new folks on Facebook. Hello, welcome. If you have any questions, put them down in the comments section and we'll be happy to answer them for you. Next, I would love to have either Frank or Lisa, whoever feels they want to speak on this, talk a little bit more about maybe some of the things we mentioned at last year's town hall that we had in the works that at this point have been a bit delayed due to the circumstances. Who would like to take this one? Let's let Frank. Ready, Frank?
Yeah, sure. And Lindsay, I encourage you to stimulate some of this as well if you've got specific points you'd like me to cover. But you know, to Lisa Curtis's point a few moments ago, I've been really surprised by the continuation of fundraising for the organization. And, you know, if anyone, we don't have many employees in the building right now. Most of the administrative related functions, people are remoting in for the most part. As you can see, Lisa Bitzer is in her office there. I am as well today, and finance is in. But so, you know, some things are continuing, but the excitement around here, despite the pandemic, is kind of palpable. It really is. I mean, I react very strongly to that when I see that and I feel that, and I can tell you that we do. And in our Zoom leadership meeting, which is our senior staff meeting, we talk about things that are happening right now that are really quite wonderful. We're beginning our park-to-park service for Chautauqua here in Boulder on the 23rd. So this weekend, it's hard to believe this is a holiday weekend, quite frankly. I just can't fathom that. It seems so early. And we also will be starting we were selected by Boulder County to start a new shuttle service for El Dorado, the El Dorado State Park, which we can do pretty much in concert with our park-to-park shuttle. We'll do that in some way in a tandem service. So that's very exciting also, that's brand new. So there's a lot of things that are happening right now in the regional transportation picture despite the pandemic. Last summer, when I spoke with participants at the town halls, I really got into quite a bit into this notion, as I spoke earlier, about the cost of paratransit, because I think that is what most people are interested in. They're not as interested in hearing about, well, what's new with fixed route transit. They might be interested in what we're doing with vehicles and our sustainability philosophy, but really most people want to know, what are we going to do about the need, the dire need for paratransit today? And as we know, that's just growing. That need is, Lisa Bitzer can tell you how many people would, if we had the money, would just clamor for those rides. We know that the demand is twice, if not 3 or 4 times the level that we're able to provide. Annually, we provide about 100,000 trips, and some of those are duplicates. But that's a big chunk of our paratransit and our community's transportation network when you think about that. And this cost structure that I mentioned last summer, and I mentioned a little while ago here, is really detrimental to the future of paratransit. And that's why I suggest that this moment, this crisis, this time is really, as unusual as it may sound, is the perfect moment to seize an opportunity to engage in a conversation with everyone touched by paratransit and everyone involved in delivering it, and say, hey, let's think about a new way of doing this. The realities being that we can only afford what we can afford, and that's a very trite statement, but we want to do as much as ultimately is required, but that's going to take more revenue. So what we've been doing, and what our board of directors, we have a wonderful, engaged board of directors, what they have asked us to do, and we started embarking on a strategic plan, and then the pandemic hit, but grow our earned income services to the point where we have enough money to fund our internal needs, our overhead, our need for new facilities, the solar, the Microgrid project that we're engaging in, and as well as be able to predict how much more paratransit service we can ultimately provide. That's what our plan is, our growth plan. And how we get there is that's the details. Those are the details that take a little bit more time. But despite the pandemic and slowing the process down a bit, we're still making progress towards those goals. And that may sound a little like Pollyanna, like, how can you really do that? But we're using this moment to try to really rationalize how we do this. And I think that's important. Lisa, would you like to add? Either Lisa's, quite frankly. Lisa Curtis, I think, wants to.
Thanks, Frank. Yeah, the Microgrid project is really an interesting project. Basically, a microgrid is turning a facility into one that can produce its own electricity so that you're operating off the grid. And we have some federal grant funding to proceed with planning on that project, and we're working closely with our counterparts at the city of Boulder and in the county of Boulder, and other local groups that are interested in their own, ultimately possibly creating their own microgrids as well, so that you increase the resiliency within the city by increasing the capacity through various microgrids, so that in the event of some sort of natural disaster, you can work off grid and that sort of thing. But it's also very important in terms of the sustainability goals, because you're capturing renewable energy and solar energy, and you're not drawing energy off a grid that uses coal burning facilities to produce the energy that would electrify a fleet. So it's very exciting. The Federal Transit Administration grant, well, actually this grant comes from the FASTER grant. Sorry, got that wrong. State FASTER grant. And again, CDOT is very interested in the innovations that VIA is undertaking and has done a lot to support us. And this grant is one of those ways to do that. So at this point, we're in the planning stage where we're identifying what the future energy needs are going to be, and then trying to plan a facility that can address that can address the charging of the fleet as it grows. So we just recently had sort of a soft launch of the project, and we're getting, we've hired a firm, a local firm, Microgrid Labs, that's done a lot of work for the Department of Energy and some military installations around the US. So we're really excited about it. It's kind of a big deal for Boulder, probably not a big deal for the United States, but locally this would be the first major microgrid going in. So it's exciting.
Thanks so much, Lisa and Frank, for that little update there. We've actually gotten to everybody's questions so far. So if anybody has any additional questions, please let us know in the comments section on Facebook or in the chat here. One thing that I think would be good to talk about, just because it's a little bit different, would be the fact that we do operate the HOP as one of our earned income contract services. And safety on the HOP looks a little bit different than on our other vehicles. And what does that look like? What are we doing for the fixed route service that we operate that's different from the paratransit service in terms of safety for our drivers and passengers? Frank, would you like to talk about that a little bit, please?
Yeah, a lot of the same protocols that Lisa Bitzer mentioned earlier do still apply, despite it being a 35-foot bus versus you know, a 10, 12, 14 passenger, what we call body on chassis buses. You see them all over town. It's a Ford cab with a box on the back. But same protocols, is just easier to distance a bit. So two important things that I think to remember, in addition to the masks, the gloves that Lisa mentioned, and sanitizing the vehicles, which, again, we talked a little bit about the fact that we want to keep, now I'm not going to get off track here, but keep some of these communication elements as we go forward in the future because they're wonderful. I think doing that is going to be something that we'll also need to do. And if we can impact the annual flu season by cleaning our buses a little bit more, why don't we do that? So I think we will continue this sort of thing. So sanitizing the buses as we're doing now, which is, you know, I think very important. And then two things that that are new and will be new is, and you see a little bit of this in the news these days, is a driver shield. So there'll be a new plexiglass shield adjacent to the driver that will protect the driver from passengers as well as protecting the passengers from the driver. And most of this, what I'm saying when I say protection, I'm talking about the confidence that the person, the rider, has. We won't let someone who is sick go out on route. And obviously the first inkling that someone is sick is having the fever and the cough. And so as Lindsay had indicated very, very much earlier, we're doing that every day, including me. I mean, I go get my temperature taken. I've been an average of about 97.3 for the past several weeks. So we're not going to let someone on route if they're showing any signs, but we want that passenger to feel confidence and comfortable, and we want the driver to feel the same way. So so the shield is something that we're getting installed really in the next couple of days, And then what we'll do is rear boarding on the hop buses. So, and you'll see this around the country with fixed route mass transit, that to the extent that they can do rear boarding, and the shield will enable front boarding again to occur, but that way you can stagger it if you need to. And that adds to the ability for the driver to control the flow of passengers, and again, the placement of passengers. And obviously we're looking for the public to, on a fixed route kind of a service, to help self-police that by where they place themselves if they're not, if they don't require assistance in getting on the bus. And that's important too, to have partners out there with the public. And Lindsay mentioned that earlier, and Lisa Bitzer did too, to have for the public to come on board with clean hands and masks and that sort of thing is vital to our network and our system, and how we go forward.
Thanks so much for that, Frank. So one other point that I would love to discuss here would be last year, we really started to ramp up our additional contracts, not just our earned income, larger fixed route and RTD contracts. We really started to reach out to the community to expand our service offerings to other folks who might be a smaller but large enough business who might have a need for us to either transport passengers on a regular basis or for a special event. So Lisa Bitzer, can you tell us a little bit about those offerings and how folks can learn more about those services?
Yeah, thanks, Lindsay. Yes, we, up until what COVID hit, we had quite a robust group trips situation going on, dealing with giving rides for senior centers to events down in Denver, maybe go out to Keensburg, to the animal sanctuary, up to the mountains to see the leaves change or things like that. So senior centers, senior living facilities, and taking groups of people, sometimes 2 buses at a time. So you're looking at our bigger buses. So you're looking at 20 people per bus, being able to go places and do things. And it was really ramping up. Of course, now with COVID, that is not the case. Group outings are not happening, places aren't open, but we will eventually see those things start to come back and open, and we'll be here and able to assist in doing that. So it's a little something extra that we do with the via Paratransit, and then also working with communities, senior living facilities that want group trips to like the grocery store, so we could do a grocery store run. We also have a wonderful partnership with True Pace, and we go ahead and take people to their facility back pre-COVID to be able to get the health care that they need and their meals and things like that. So eventually those places will open back up as well. And then new endeavors that we're always looking into, especially in the area of Firestone, Dacono, and Frederick, where they don't have much in the way, in fact, pretty much nothing in the way of transportation, and what that looks like, that we could get out there and start getting people where they need to go. So a lot of things that were in the works or that we're working that are now a little bit on hold, but we know that those things will eventually open back up in time, and we'll be there.
Thanks, Lisa. Before I move, Frank has a point to add, and we'll move over to him to add on to that a little bit, but then I'll be back over to you. We had another question come in. So first, let's have Frank expand on what you said.
Thanks, and I'll start to use the raise my hand protocol. So I just wanted to add to that Lisa's very modest about this. She's done an amazing job in growing that part of our market. And that was, in terms of last summer when we were in the town halls talking about growing our earned income. It's not just when you look at fixed route opportunities, it really is very much in this shuttle service that Lisa mentions in that Carbon Valley area. And obviously it's not a one-way street. We're working closely, and Lisa's really spent the time to develop the relationships. And that's, Lisa and I talk about the fact that growing that part of this business is really all about the relationship building. We use buses, yes, and we use technology, but it still is about people and arranging the service and convincing people that we can do it. And she's done a marvelous job of that. And we were poised just before the pandemic to start several elements of this, which again, further diversify our revenue and make it easier to begin to deliver more paratransit. So I just wanted to both compliment Lisa for that and also say that, I want to get back to that new reality as soon as we can.
Thanks so much for that, Frank. Now, Lisa, we had a question come in. I think you would be the best to address this one. How are our riders doing? And is VIA doing anything to stay connected with our riders?
Our riders are doing well. They are a hardy bunch. And this is, I'm sure, been tough for them. But we here at the call center, when they call in, we're able to give them a little extra time and talk to them and see how they're doing and how things are going. Do they need anything? Even if it's something that VIA couldn't do, we are a wonderful resource for letting people know numbers to call or to get the help that they need that VIA may not be able to do. And then we check up on several of our riders that are that we know need that little extra care. And so we make phone calls and just see how they're doing, how things are going. We're staying in touch with senior centers, Sue Corbett out in Brighton and Diane Evans in Louisville, just to name a few, and making sure that their needs are met, and if they have anyone that needs anything, how we can jump in and help out. So we're doing everything we can to be there for the community and stay in touch with our riders and make sure that they're okay. And if they need anything, we are definitely thinking outside the box. So if we can provide it and we can get it to them, we'd be more than happy to.
That's great. Thanks so much, Lisa. I think that's a really good point in general. If you have a need that you think we can meet, let us know and we'll do our best to meet your need. Or if we aren't able, we'll get you in touch with somebody who can. So we have another question that came in from Facebook, and I think we'll probably have Frank address this one. There's a lot of variance in the country regarding moving forward or opening up for business. What is VIA's position regarding this process?
Well, thanks, Lindsay. We really do, as you can imagine, my answer might be very much linked to what our governor is advising. And Lindsay's part of a joint communication structure with the cities and the county government as well, and the emergency management structure here in Boulder County. And they stay very much in close contact with the governor's office, and everything that comes out of the governor's office in terms of the safer at home, for initially stay at home and safer at home orders. And as Lindsay mentioned earlier, we're all looking forward to what the governor might have to say on the 25th in terms of adding some additional flexibility to the safer at home orders. But we have to really comply with the governor and with the public health and public safety mandates. We would not and could not begin to do something that would violate that. I mean, we hold a public trust in all that we do. We are a nonprofit entity, and yet we serve the public and we serve the community. And Lisa Curtis is fond of calling us a community transit agency, and we are very much that. But if you're going to be that, if you're going to do that, as they say, you've got to really make sure that you're following the rules and the regulations and best practices for health and for security. And, and that goes for this pandemic. It would hold true for times of natural crisis when we had floods here in Boulder or wildfires, and VIA is a second responder in most of those instances, evacuating people. But again, when we do that, we don't do it in a vacuum. We do that very close alignment with the public safety officials in the different jurisdictions that are in play. But in this case, we really are tied to what the governor tells us to do, and with respect to the degree of flexibility and openness.
Thanks so much, Frank. I think another great thing to note is we are in absolutely no rush whatsoever to start loosening any of our internal processes to keep everybody safe and healthy. Our safety of our staff and of all of our riders is absolutely our top priority, and we'll continue taking these necessary health and safety measures long after the orders may relax. Great. So we are all out of questions, and we're about 15 minutes from the end of our webinar here. So I'm going to hand it over to Lisa Curtis for some closing remarks. If you have any last minute questions, definitely let us know. We're happy to get to them. So Lisa.
Thanks, Lindsay. Again, I want to thank everyone who participated. I want to thank our panelists. I want to thank Frank and Lisa Bitzer. We interrupted her really busy day. She's usually got so much going on that it's hard for her to take an hour and a half out of that day. But thanks everybody, and Frank as well. We started these town halls last year as a way to get feedback from our riders. We also do an annual survey to find out how our services are impacting our riders. But I want to just encourage people who use our services to keep in contact with us. You have our emails. We like to keep the conversation going. We want to know how you're impacted. We know that there's probably a lot of people who are feeling just isolated and deprived right during this time. I think everybody's going a little bit stir crazy. Most of the people that are our clients have been self-isolating for several months now, over 2 months, and that's a long time. I'd also like to encourage people to, especially our riders, to join us on Mondays for our morning coffee event, the first Monday of every month. And if you be sure and sign up for VIA's newsletter on our website, so you'll receive notices about that event. We have a first Thursday event every month as well. And these are just venues where we're isolated from one another and a bit, we're not having a lot of personal contact with face-to-face contact, but we're trying to keep communications open. We are, as I said, a values-driven organization, and we are here to serve, and we want to hear from you. So that's really, thanks for joining us, and we look forward to keeping the conversation going.